Hi, Dr. Yass here, and this is another episode of Dr. Yass live on YouTube. And this is going to be kind of brief. I just think that too many people who are suffering from chronic pain have now been convinced by the medical establishment that chronic pain and chronic illness are basically synonymous, and therefore it's acceptable that people have chronic pain. It's simply a fallacy. There's absolutely no reason to believe that chronic pain should exist at all. So I just wanted to talk about the difference between what is in fact chronic illness and what is chronic pain. Chronic illness is a degenerative process of an organ. So maybe you have cirrhosis of the liver, right? Maybe you have congestive heart failure. Maybe you have a kidney stone that progressively worsens. So what you see in these cases are where you have an organ that is slowly degenerating. There is, in fact, cell death, right? The tissue is degenerating. That is what chronic illness represents. Oftentimes it can be reversed. A lot of times it can't be reversed. They can try medications and all these types of things, but it is a slow progressive degeneration of tissue. Chronic pain, on the other hand, is sustained pain, but pain is not a tissue. Pain is an indication. It's a signal that represents a tissue is in distress. So what chronic pain represents is simply the fact that a tissue is in distress and it has not been identified appropriately through the proper diagnostic model, which has allowed the tissue to continue to be in pain, therefore continuing to emit the emergency distress signal of pain. So chronic pain is not representative of a tissue that's in distress and deteriorating. Pain doesn't represent deterioration. Pain just represents a tissue in distress. Now, in more than 98% of cases, the tissue in distress is muscle. The reason for the distress is because the force requirement of activities is greater than the force output of muscles. This is not a representation of deterioration of muscle. That's where the confusion lies, is that chronic pain associated with muscle somehow represents deterioration. No, tearing of muscle would represent some sort of deterioration of muscle, right? That is different than a muscle just continually straining because the force requirements of your activity are greater than the force output of your muscles. And I have shown that in more than 98% of cases, the cause of pain is muscular, regardless of whether you've had a MRI show that there's some structural abnormality. That is simply showing something that exists, and it exists independent of the tissue in distress. You know that because as many people with no pain have the same structural variations identified, and all treatments associated with these structural variations have been ineffective in resolving the pain the person's having. You know that quite clearly because the medical establishment created the diagnosis failed back surgery syndrome, which represents that you had a surgery and the symptom being experienced after is exactly the same as before. So there's no question that these structural variations are not causing pain, that in fact it's muscular. And the legitimate reason for that is the force requirement of your activities is greater than the force output of your muscles. So let's be very clear. There is a massive difference between the idea of having chronic illness, which is something quite serious and needs to be addressed to the best of the medical establishment's ability, and chronic pain. Chronic pain simply means that a tissue is in distress. It has not been identified appropriately. Therefore, it continues to elicit the emergency signal of distress. In most cases, it's muscle, which cannot be identified by diagnostic tests, nor is there any medical establishment specialty that is educated or trained to identify these muscular causes. That is why you need the Yass method. The Yass method is different. It's outside of the medical system. It uses the body's presentation of symptoms to identify the tissue in distress, eliciting those very symptoms. Again, in more than 98% of cases, the cause is muscular, and it can be resolved through the performance of isolated progressive resistance strength training, which is at the core of the Yass Method. If you want to get more information about the Yass Method, you can contact me at Dr. Mitch at mitchellyass.com, DRMITCH at MITCHELLYASS.com, or you could go to my website, livewithoutpains.com. That's livewithoutpains, plural.com. Get more information. The great news is the Yass Method can be performed through Zoom session. And as a result, it doesn't matter where you are in the world, you can get this method easily and effectively at the comfort of your own home at a time that you choose by scheduling a Zoom session, again, at livewithoutpains.com. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.